Hello and welcome back to the Medigap Show. I'm your host, Holly Cohen. Today we're going to delve into a very thought-provoking topic: Medicare Advantage extra benefits, if you want to call them that. Medicare Advantage plans lure customers with television ads promising plans with dental, vision, and hearing benefits that traditional Medicare doesn't offer. As highlighted in this article, Medicare Advantage plans attract customers with promises of dental and vision and hearing, which aren't typically covered by original Medicare. They're expecting to get dentures or crowns or bridges, really expensive dental work, and they may end up in a plan that covers cleaning and an x-ray, and that's it. Julie Carter of the Medicare Rights Center said. And this is by Jesse Hellman, posted May 22nd, 2023. Medicare Advantage plans lure customers with television ads promising plans with dental, vision, and hearing benefits that traditional Medicare doesn't offer. But in a series of reports, experts and advocates question the actual value of those benefits to enrollees, who often find they still have to pay significant amounts out of pocket. She said the organization's hotline has increasingly received calls from Medicare Advantage beneficiaries complaining about their dental benefits. Medicare Advantage, a private alternative to Medicare offered by insurance companies, now covers half of Medicare enrollees, in part because of the supplemental benefits they offer. While some enrollees are happy with their coverage, others say they feel misled about the comprehensiveness of their plan's dental benefits. How much is it coverage in name only? How much of it is used as a marketing device rather than a means to provide tangible benefits, said David Lipschutz, Associate Director of the Center for Medicare Advocacy, a nonprofit that supports access to comprehensive Medicare coverage. We've actually been hearing from Medicare Advantage enrollees who were disappointed in their dental coverage, Lipschutz said. While 94% of Medicare Advantage enrollees in 2021 were in plans that included dental coverage, studies have shown that they are just as likely as traditional Medicare beneficiaries to face trouble accessing needed oral health care. Overall, 13% of all Medicare beneficiaries 65 and older said they could not get dental, hearing, or vision care in the past year, according to KFF, which is Kaiser Family Foundation, a health research organization. Those statistics don't differ from Medicare Advantage and traditional Medicare enrollees, studies show. Despite the vast majority of Advantage plans claiming they cover dental services, we saw that a pattern was pretty similar between people who enrolled in traditional Medicare, which doesn't have a dental benefit, and a Medicare Advantage, which may have a dental benefit, said Lisa Simon, co-author of a study published in Health Affairs in February. That study found that dental care decreases after people age into Medicare, regardless of whether or not they are in an Advantage plan. That could be because the enrollees aren't aware of their dental benefits. There aren't enough dentists accepting those plans, or the coverage might not be very generous, Simon said. Costs and coverage. Another study published last year in JAMA Network Open found that low-income adults in traditional Medicare and Medicare Advantage face similar challenges accessing dental care because of costs. Medicare Advantage plans typically cover preventative care like annual cleanings without cost sharing, but more extensive dental services usually require enrollees to pay for a portion of their care or aren't covered at all. Plans also typically cap how much they will pay for care in a given year, with more than half of Advantage enrollees in a plan with a maximum dental benefit of $1,000 or less, including amounts spent on preventative care, according to KFF. Lipschutz said one woman that his organization is working with has an Advantage plan with a $2,500 per year cap on dental care. When she got treatment for an oral infection, her services, including x-rays, were not covered, despite the dentist and plan telling her it would be. Even if you have a generous out-of-pocket cap, it may not mean that much of the dental care you need will actually be covered, Lipschutz said. An information black hole. Part of the problem, experts say, is the lack of transparency and standardization about what supplemental benefits must cover, meaning benefits can vary between the thousands of Advantage plans on the market. Medicare.gov's Plan Finder tells people limits might apply to a plan's supplemental benefits, but don't go into specific details. And Advantage plans don't typically report information to the federal government about how those benefits are used, what type of services are covered, or how much beneficiaries pay out of pocket for that care. That creates an information black hole about how useful those benefits are to beneficiaries, despite the fact that the taxpayers are paying for it. In 2022, rebates that plans got from the government to cover those benefits totaled $164 per enrollee per month, according to MedPAC. The line of sight on the offerings, what is being used and what is the value to the beneficiary, is very hazy, said Mark Miller, executive president of healthcare at Arnold Ventures, a former executive of the Medicare Payment Advisory Commission. Miller said he wants the Centers for Medicare and Medicaid Services to collect data on what supplemental benefits cover, whether they are being used by beneficiaries, and how much plans are spending on those benefits. Benefits should also be standardized across plans so beneficiaries can make easier decisions, he said. The Government Accountability Office has also recommended that CMS clarify guidance to Medicare Advantage on what kinds of data must be submitted, including data about the use of supplemental benefits. CMS said it does require plans to submit that information, but that it will issue guidance clarifying those requirements. 3 Medicare Advantage organizations told the GAO they do not report that information because they are not required to. The Senate Finance Committee's majority staff has recommended that CMS provide model language for Medicare Advantage plan marketing to explain the out-of-pocket costs and network limitations for extra benefits such as dental, vision, and hearing. The issue has led the American Dental Association to complain to CMS that their patients thought they had more comprehensive coverage than they actually have. Dentists often must explain to patients how the misleading marketing tactics have resulted in the purchase of a plan that does not deliver the dental benefits patients thought it did, a spokesperson said. Many dentists have reviewed the Medicare Advantage plan materials their patients bring to them, only to find out that it only covers a dental cleaning and not comprehensive care, or that the cost of the plan is not worth the benefit of the services covered. Because of the way plans are paid, government spending per beneficiary is typically higher in Medicare Advantage plans than in traditional Medicare. Some lawmakers argue that the government should reduce payments to Medicare Advantage plans and use those savings to expand dental coverage to the entire Medicare population. We could use this money to provide the dental care that people across this nation need, Senator Elizabeth Warren of Massachusetts said at a Senate Finance Committee hearing in March focused on oral health. However, many enrollees found that the actual value of these benefits may fall short of their expectations. Most dental policies have a max benefit of $1,000 or $1,500, or some can go up to $3,000 if you're purchasing as an individual policy. I'm not referring to the employer group dental policies, which are phenomenal, much better than a person can buy on their own. According to experts like David Lipschutz from the Center for Medicare Advocacy, even plans with seemingly generous out-of-pocket max benefit may not adequately cover essential dental care. Enrollees can face unexpected expenses for necessary treatments. Surprisingly, studies indicate that dental care tends to decline as individuals transition into Medicare, irrespective if they have a Medicare Advantage plan or traditional Medicare. This raises concerns about the effectiveness of these plans in providing comprehensive dental coverage. A regular dental policy that an individual can purchase on their own is just a basic policy, unless you work for a large corporation and are offered an amazing dental policy because there's lots of people in that group. When you're purchasing your own individual dental policy, like I said earlier, your max benefit is typically $1,500. And that's what typically they give you inside a Medicare Advantage plan. I have seen some that do cover dentures and that do cover some crowns, but those specific plans are for people who are offered Medicare and Medicaid rather than just a regular Medicare Advantage plan. Medicare beneficiaries have unknowingly enrolled in these Advantage plans that fail to provide the comprehensive dental benefits that they expected. In response to these issues, some lawmakers propose reallocating funds from Medicare Advantage plans to expand dental coverage for all Medicare beneficiaries. The approach aims to address the urgent need for accessible dental care across the nation. So that concludes our discussion on Medicare Advantage plans and the benefits that are often advertised. It's crucial to carefully evaluate the actual value and coverage of these plans to ensure they meet your individual needs. Stay informed, make informed decisions, and join us next time on the Medigap Show for more valuable insights into the world of Medicare. Also, remember to subscribe, and if you like the video, hit like. Be well.